There are two specialties that actually do spinal surgeries. There are neurosurgeons and there are orthopedic spine surgeons. I do come from an orthopedic surgery background. What sets an orthopedic surgeon who does spine surgery separate from a neurosurgeon is the ability to encompass the spine with the rest of the musculoskeletal system. Oftentimes you have people who come in with hip pain and they're pointing to their groin area, and that's truly the hip joint, and being able to look at their lumbar spine x-rays and being able to see where their pelvis and their hip joint sits, you can often go ahead and say, hey, Mr. and Mrs. Smith, that this is, you actually need a hip replacement, which is something that we were trained to do during our residency years. And you can actually take care of the patient, by referring them out to a hip replacement specialist to do that. Or if they've got localized pain that radiates upward from their knee into their hip, looking at those X-rays to be able to say, hey, I think you have more hip arthritis, knee arthritis, and this may be something that's not related to your spine. Although it seems sometimes that these are so interconnected, and it really takes someone who is tuned in to the entire musculoskeletal system to go ahead and say, hey, is this truly coming from the spine? Oftentimes you'll see people who do have spine pathology, but their symptoms are not related to the spine, but rather more peripheral related issue, and therefore it'd be more appropriate that a proper physical examination, more importantly the history, if you really key into the patient's symptoms, that will lead you down the right path. So we're really treating the patient and what their symptoms are rather than just looking at the x-rays and MRI. Therefore, the correct procedure for the correct diagnosis will always lead to the best outcome. You start treating the MRIs or the x-rays and you don't really listen to the patient, you often find yourself with a poor outcome and an unhappy patient.